question and maybe to purity. The question of we are experiencing even more deaths. Yes, indeed, we are getting more cases. If the case fatality rate has remained fairly low, the more cases you receive against that case fatality rate, there will be that perception that you are getting more deaths. But the actual measure is that case fatality rate. But yes, indeed, you'll be recording more numbers as you record more numbers of positive cases. And what should be worrying us more actually is the rate at which the samples we are taking are turning positive. That is what is more worrying to us, not the increased number of cases that are dying, because this is due to the number of cases. But you're getting more number of cases because more people are turning positive. The positivity rate is going higher, so that for every 100 patients that you sample, 29 are turning positive in Nairobi, because that is what the figures we have today. That is the more worrying figure. Our healthcare workers are continuing to work very, very hard. And that is why the mortality, though high, is still maintained. We are maintaining a case fatality rate, because our healthcare workers are working day and night to try and reduce mortality amongst our cases. Over to Alpha's questions on number of facilities that are ready to offer COVID treatment. I think we offered this figure the day before yesterday, and we said that there is the extraordinary summit, I think the day after tomorrow, called by His Excellency the President. And the updated figures are going to be provided of number of isolation facilities that are available. But as at the last announcement, the last summit, remember we said there were 282 facilities, 282 facilities that were prepared by county governments in readiness for COVID treatment. And out of this, there were 12,513 normal isolation beds and 498 ICU beds. Now, when I said that there are teams going out there, they are verifying and working together with counties. When the country was opened up on 6th, we had to make sure that we are opening up a country and counties were prepared. So they went out verifying this information and working with the counties to make them more prepared. So that it's not just the beds alone, but in terms of equipment, oxygen, healthcare workers, matching all this, the preparedness, not just the beds, but total preparedness to handle COVID-19. Before that, we had one of our work streams in our task force that had done this area and had its own figures. And this had verified some of these facilities actually. So I know as we stand, there are those 282 facilities and 72 of them are fully verified by our task force. And more reports are coming to us as the groups continue working out there. And in this, out of these facilities, we told you as of today, we have 1,394 patients admitted out of all these isolation beds that are available. On the issue of bars, I think you have talked about this again here. And I stressed this on Monday, that in his address on 6th of July, I did not hear a declaration from the President that bars are to be opened. So bars still remain closed. So if bars are operating, they are operating illegally. And we mentioned here that if your bar is closed and permits withdrawn, do not blame anyone. And security agents are out there and they are nabbing most of these bars, but as we said here, we cannot police every other Kenyan. Because you close this bar, there's one behind this building that is open. We cannot have a police officer for every bar. There are too many. So it's again urging Kenyans, bars are still closed. And I said here, I think 2 days ago, that what is appalling and is heartening is actually the behavior in those bars. And I said people have thrown caution away. People are behaving in the pre-COVID ways. masks have been thrown off, hand washing is not there, and we are urging Kenyans, if there's a time to be careful, it is now. So if you have to take your drink, what the president advised is, and actually directed, is that alcohol be sold as a takeaway, on takeaway basis. If Kenyans cannot abide by this, I don't know what will come of the extraordinary summit, but it is quite disheartening, and we are noting this also as a ministry and as a government. It is quite disheartening. Restaurants were opened so they could sell foods and open up the economy, but those restaurant owners have turned those restaurants into bars. So if those restaurants are closed tomorrow or the day after tomorrow, they have asked for that closure. I don't know what decision will be made, but the note has been taken of this misconduct of restaurant owners. And I would urge the decision makers to take very stern action against those contravening these laws. On the issue of security guards, again, guards are not exempt from any other Kenyan. And as long as they keep to the containment measures, they'll be safe. I know they have high rates of contact with the other citizens as they man entrances and doors, and gates. And what we urge of them is to maintain the containment measures as advised. And those who keep these measures are keeping safe. That simple act of wearing your mask properly is protecting you, much as you may not know. And it's not just the security guards. Those are even safer because there's someone reminding them when they are taking the temperature that please put on your mask properly. More disheartening are others like street vendors. Walk across the city of Nairobi and you'll be amazed. Walk across the markets. So as you're worried about security guards or even safer, worry about ordinary Kenyans, even those visiting bars, who are actually throwing caution out of the window. So security guards are at high risk, and we keep advising them to keep the containment measures, wear your mask, wash your hands, sanitize. And as they are taking temperatures, you have advised them, don't take your temperature from the front of an individual, take that temperature from the sides. When you are addressing people, keep your distance as you address those that are approaching you at the entrance of these buildings and compounds. So it's containment measures for them that we are keeping, and we have issued guidelines on workplace safety, that they are urging those employers to keep urging their security guards to keep employing. I think that was all.
Thank you, Dr. Kuria. I want to add to respond to Purity's question regarding the numbers in terms of comorbidities. I can tell you that when we had about 250 deaths, and that was not too long ago, when our number of fatalities were 250, we do know that 129 of these 250 had comorbidities, 129 of them. And